Hello guys, good morning. So today we are going to discuss the next topic of the general anatomy, that is the nose and the nasal cavity. So nose acts as a respiratory passage and the organ of smell. So basically your nose, it is triangular, or you can say a pyramidal in shape. It has a root, or you can say it has a tip, it has a base. So the upper 1/3 part is made up of bone, while the lower 2/3 part is made up of the cartilage. So the receptor for the smell, these are placed in the upper 1/3 of the nasal cavity. And the upper 1/3 of the nasal cavity, it is lined by the olfactory mucosa, while the lower 2/3 of the nasal cavity, it is lined by the respiratory mucosa. So the function of the respiratory mucosa is it is a highly vascular and warms the air which we inspired. So the function of the secretions of the serous gland is to make the air moist, while the function of the secretion of the mucous gland is to trap the dust and the other particles. So the nose, it acts as an air conditioner where the inspired air is warmed, moistened and cleansed before it is passed on to the delicate lungs. So basically nose is divided into two main parts, that is the external nose and the nasal cavity. The external nose, it is pyramid in shape. It is pyramid in shape. It has a root, it has a base. So 1/3 of the part, upper part, you can say the 1/3 upper part is made up of the bone, while the lower 2/3 is made up of the cartilage. So it has an osteocartilaginous. Osteo means bone, cartilaginous means cartilage. It has an osteocartilage framework which is covered by the muscles and the skin. So the external nose, it has a root, a dorsum tip, the anterior nares, the nasal septum and the columella. So the external nose, it has the two elliptical orifices, these two, which is called as nostrils or nares. It is separated by the nasal septum. And the lateral margin, this is the lateral margin, it is round and mobile and it is known as ala. So this is the osteocartilaginous. So this is the osteocartilaginous framework. The upper 1/3 is bony, while the lower 2/3 is cartilaginous. And it is the osteocartilaginous framework, it is composed of the skin and the muscle. So this is the skeletal framework. Though it is partially bony, it is partially cartilaginous. So the bones are the nasal bone. The nasal bone, it is the nasal bone and it forms the bridge of the nose. And the nasal part of the frontal bone. Okay. So this is the bone, nasal bone, which forms the bridge of the nose and also the nasal process of the frontal bone and the frontal process of the maxilla. Coming on to the cartilages. So the cartilages are the superior, these are the superior upper lateral cartilage, while these are the inferior lower lateral cartilage, and these are the alar cartilage. So it is very important that the skin over the external nose, it is supplied by the external nasal, infratrochlear and the infraorbital nerves. Coming on to the nasal cavity. So nasal cavity, it extends from the nostrils till the posterior nasal apertures. So it is divided into right half and the left half by the nasal septum. This is the nasal septum which divide the nose into the right half and the left half. So these measurements are very important for your exam point of view, that each half has a roof, a floor and a medial and the lateral walls. So each half measures about 5 cm in height, 5.5 to 7 cm in length, while 1.5 cm in width. And the width near the roof is only 1 to 2 mm. So this is the roof. It is 7 cm long and 2 mm wide. So it slopes downward from front to behind. So it has a 3-part. The middle part, which is formed of cribriform plate of ethmoid. The anterior part is made up of the frontal and the nasal bone, while the posterior part is made up of the body of sphenoid. It has a floor which is formed by the palatine process of the maxilla and the horizontal plate of the palatine bones. This is the floor of the nose and this is the roof of the nose. This is the cribriform plate. So nasal septum. The nasal septum, as you know, it is the partition between the two halves of the nasal cavity, and on each side it is covered by mucous membrane and forms the medial wall of both nasal cavities. So it has a bony part, it has a cartilaginous part. So bony part, it is formed by the vomer and the vertical plate of the ethmoid. This is the osseous part. And the cartilaginous part, it is formed of septal cartilage. This is the septal cartilage and the septal process of inferior nasal cartilages. So the cuticular part or the lower end, it is formed by the fibrofatty tissue covered by the skin, and the lower margin of the septum, it is called columella. And the septum, it has the 4 borders and 2 surfaces. The 2 surfaces which divide the nose into right and left, and borders are the superior, inferior, anterior and posterior. Coming on to the arterial supply, this is the anterior superior part, this is the anterior inferior part, this is the posterior superior part, and this is the posterior inferior part. So the anterior superior part, it is supplied by your anterior ethmoid artery, while your anterior inferior part, it is supplied by superior labial artery. Your posterior superior part, it is supplied by greater palatine artery, and your posterior inferior part, it is supplied by this one. Posterior inferior part is supplied by sphenopalatine artery. So this is very important. This area, this particular area, it is known as little area, or you can say Kesselbach plexus. It is the common site for bleeding of the nose or epistaxis. Very important for your exam point of view, this little area. So the anterior inferior part or the vestibule of the septum contains the anastomosis between the septal ramus and the superior labial branch of the facial artery. As I have already told you, the Kesselbach plexus, this is the commonest site of the bleeding from the nose, and it is also called as, this area is little area. It is Kesselbach plexus, and this is the commonest site for the bleeding of the nose, this area. Coming on to the nerve supply, the general sensory nerve arising from the trigeminal nerve. So the anterior superior part, it is supplied by the anterior ethmoidal nerve. Anterior inferior part, it is supplied by the anterior superior alveolar nerve, while the posterior inferior, it is supplied by the nasopalatine branch of the pterygopalatine ganglion, while your posterior superior, it is supplied by the medial posterior superior nasal branch. So special sensory nerve, these are the olfactory rootlets, or you can say the olfactory nerves. These are confined or located to the upper part of the olfactory area. Lymphatic drainage, anterior half of this is drained into the submandibular nodes, the posterior half to the retropharyngeal and the deep cervical nodes. Coming on to the lateral walls. These are the lateral walls. This is the nasal septum, this is the lateral wall. So the lateral wall, it has a three, this is 1, 2, 3, 3 shelf-like bony projections, which is called as conchae. So the function of the conchae is to increase the surface area of the nose for effective air conditioning of the inspired air. These are the three shelf-like 1, 2, 3. These are the three shelf-like bony projections. So the lateral wall separates the nose from the above. It separates the nose from the orbit and from the maxillary sinus below, and from the lacrimal groove and the nasolacrimal canal in front. This is the orbit, this is the maxillary sinus. So it separates the nose from the above orbit and from maxillary sinus below, and from the lacrimal groove and the nasolacrimal canal in front. So the lateral wall, it can be subdivided into three parts: the anterior, the middle and the posterior part. The anterior part, it is called as vestibule, while the middle part, it is called as the atrium of the middle meatus, and the posterior part, it contains the conchae or conchae. So the bony part, it is formed from before backward by the following bones: the nasal bone, the frontal process of the maxilla, the lacrimal. This is the labyrinth. This is the labyrinth of the ethmoid with superior nasal concha and the middle nasal concha. This is the superior one, this is the inferior one, next is the inferior nasal concha, and this particular plate, it is the perpendicular plate of the palatine, and last is the medial pterygoid plate. Coming on to the conchae and the meatuses. The nasal conchae, these are the curved bony projections which directed downwards and medially. So there are three conchae, that is the inferior concha, the middle concha, this is the inferior concha, middle concha and superior concha. So the inferior concha, it is an independent bone, while the middle and the superior concha, these are the projection from the medial surface of the ethmoidal labyrinth. So there are three meatuses. The inferior meatus, it is the largest of all the three meatuses. So in this, the nasolacrimal duct opened it at the junction of its anterior 1/3 and posterior 2/3, and the opening, it is guarded by the lacrimal fold, or you can say the Hasner's valve. The middle meatus, it lies underneath of the middle concha, and there is an ethmoidal bulla. This portion, it is the rounded elevation, or you can say the ethmoidal bulla, and below this we have the hiatus semilunaris. This part is the hiatus, this part is the hiatus semilunaris, and this is the infundibulum. Infundibulum, it is a short passage at the anterior end of the hiatus. This is the middle, this is all about the middle meatus. So this is the opening of the frontal sinus as the anterior part. This is the infundibulum. So this is the posteriorly, there is an opening of the maxillary sinus. It is located posterior to the hiatus semilunaris. Okay, and this is the opening of the middle ethmoidal sinus. It is present at the upper margin of the bulla. This is the opening of the middle ethmoid air sinus. So the superior meatus lies below the superior concha, and this is the superior meatus. It is the shortest and the shallowest of all the three meatus. So it receives the opening of the posterior ethmoidal air sinuses. So the this is the sphenoethmoidal recess. This is triangular in shape. Can you see this? This is triangular in shape. This is the triangular fossa. It receives the opening of the sphenoidal air sinus, and it is above the superior concha. This is the superior concha, and this is the triangular fossa, or you can say the sphenoethmoidal recess. And the function is it receives the opening of the sphenoidal air sinus. Coming on to the agar nasi. So the atrium of the middle meatus, this is the atrium. This is the atrium of the middle meatus. It is present at the middle of the infundibulum, or you can say the middle, or you can say the in front of the middle meatus and above the vestibule. So your atrium, it is present in just front of the middle meatus and above the vestibule. This is the agar nasi. The agar nasi, it runs forward and downward from the upper end of the anterior border of middle concha. This. Coming on to the arterial supply. So the anterior superior quadrant, it is supplied by the anterior ethmoidal arteries and the posterior ethmoidal arteries, while the anterior inferior quadrant, it is supplied by the branches of the facial arteries. These are the branches of the facial arteries. The posterior superior quadrant, it is supplied by the sphenopalatine. This is the posterior superior quadrant. It is supplied by the sphenopalatine artery, while the posterior inferior quadrant, it is supplied by the greater palatine, the posterior inferior. So this part is the anterior superior, this is anterior inferior, this part is the posterior superior, and this part is the posterior inferior. Coming on to the venous drainage. So anteriorly into the facial vein, posteriorly into the pharyngia of the veins, middle part to the pterygoid plexus of the veins. Coming on to the nerve supply. So anterior superior quadrant, it is supplied by the anterior ethmoidal nerve, while the anterior inferior quadrant, it is supplied by the anterior superior alveolar nerve. Your posterior superior quadrant, it is supplied by the posterior superior lateral nasal branches, while the posterior inferior, it is supplied by the branches of the anterior palatine nerve. So before this, I have one important point, that the blood supply of the nasal septum and the lateral wall of the nose is supplied by the ophthalmic artery, facial artery, and the maxillary artery. I repeat, the blood supply of the nasal septum and the lateral wall of the nose is supplied by the ophthalmic artery, the facial artery, and the maxillary artery. So this is all about the nose and the nasal cavity. It is very important topic. Please go through this lecture once. Thank you.